Well, a major area health network has a new policy in place. It is designed to keep its workers from getting you sick anytime you visit their hospitals and clinics. Jordan Burgess live with the change and its hoped for impact. Jordan?
Well, hospitals are supposed to be places where you get better, not get sick. But that's not always the case, and that's why the Kettering Health Network is taking a step to try to cure disease and not spread it. Walk through any hospital and you'll find so much soap and disinfectant you could swim in it. But even that's not always enough to keep germs from spreading.
If they come to work and they've got a cough but they just can't miss work that day, it can be transmitted to the vulnerable patients.
That's why the Kettering Health Network is joining others in now requiring all employees and volunteers to get a flu shot this year. The thought is if they don't have the flu, they can't give it to you.
If healthcare workers are vaccinated, that there's less transmission of flu from the healthcare workers to patients.
You would think those in the medical field would be first in line for flu shots, but just like the rest of us, some are hesitant to get the shots for various reasons.
There are a lot of misconceptions about the flu vaccine.
Among those are that the vaccine can make you sick.
Or you cannot actually get the flu from the vaccine. So I think when that happens, people are maybe getting an incidental infection, something that's just a coincidence and was not really related to the vaccine.
Another is that the flu isn't a big deal.
Other people just say, well, the flu's not that bad, I don't need the vaccine because it's just like the cold. But influenza can actually make people very, very sick.
And that's the last thing needed for those in the hospital who are already suffering.
We never really know at what point it's going to hit each year, but we know it hits every year. So it's best to get the flu shot early.
Now, I'm told exceptions for those mandatory flu shots will be made for people based on religious and medical reasons, and those will be dealt with on a case-by-case basis. Reporting live, Jordan Burgess, 2 News.